Now let's look at the clinical features of rheumatoid arthritis. Typically, they have early morning stiffness that can last for quite a while, hours. Sometimes it is minutes in the very early stages, but usually it's hours, sometimes the whole day. And I've already told you it's a symmetrical arthritis and it's a polyarthritis affecting many joints, mainly hands and feet, but other joints can be affected, knees, shoulders, elbows and wrists. And neck. In the spine, this is one of the questions that comes up in some entrance examinations. Which part of the spine is affected in rheumatoid arthritis? It is the neck, the cervical spine. This shows the metacarpophalangeal joints that are swollen and the PIPs in early rheumatoid arthritis. This shows the deformity that occurs in rheumatoid arthritis. This is called a Boutonniere deformity, in which the proximal interphalangeal joint is flexed and the distal interphalangeal joint is extended, and the opposite happens. This is called a Swan neck deformity, in which the DIP is flexed, distal interphalangeal joint, and the PIP, that is the proximal interphalangeal joint, is extended. In this, if you look at the proximal joint, you can tell what the pathology is. So it is flexed. So there is a problem with the extensor tendon. So the extensor tendon, when that is ruptured or tenosynovitis happens, this happens in a Boutonniere joint, and the opposite in a Swan neck. Apart from polyarticular onset, there are different patterns of onset of rheumatoid arthritis. It can be monoarticular, although rare. The onset can be gradual or abrupt. Usually it is gradual, whether it's monoarticular or polyarticular. And extraarticular features can occur first, especially lung. And there is something called palindromic rheumatism, where it is episodic. The extra-articular manifestations of rheumatoid arthritis can involve any part of the body, really. The commonest one is lung. In lung, you can get interstitial fibrosis, or you could get something called Kaplan syndrome, which is pneumoconiosis, producing nodules in the lung on exposure to silica or asbestos. But you can get lung involvement not just with the disease, that is the rheumatoid arthritis itself, but as a complication of the treatments that we give. I'll come to that in the next few slides. Skin involvement, you can get nodules. These nodules are painless. The rheumatoid arthritic joint is painful, but the nodules are painless. And the nodules happen more in seropositive patients, associated with seropositivity. Seropositivity means rheumatoid factor positive. I'll again come to that in the next few minutes. The heart is also inflamed because there is, it is inflammation basically. So it can happen in any part of the body. When the eyes are involved, you can get episcleritis. Keratoconjunctivitis thicca is the commonest problem. But you can get scleromalacia as well. And it can affect any other part of the body. There is neurological involvement, there is bone involvement with osteoporosis, there can be muscular involvement, there can be hepatic involvement. So it can affect any part of the body. Vasculitis is a serious complication with ulcers and a lot of problems accompanying it. There are overlap syndromes with other autoimmune disorders as well. So this is scleromalacia in rheumatoid arthritis. This is interstitial fibrosis, as you can see in this X-ray.